It's up there. Okay, hi, my name's Christopher. Welcome to the Lunch and Learn for this week. From now onwards, we'll be doing our Lunch and Learns once a month. So check into our Zedmed website to check what the upcoming Lunch and Learns going to be. But remember, we record all of these Lunch and Learns, so you can also watch them back on the Zedmed website, like an on-demand service there. As you can see, today we're going to be doing a very fast clinical overview for doctors. Housekeeping first, though, please do remember to mute your microphone up the top section here on your side panel there. Please mute it so that, we can get through everything that we need to get through there. You feel free to leave any questions down the bottom in the chat section there. And if we've got some time right at the end, we'll get through them. But we've got about 25 different topics to cover in the session today. Normally, when we do clinical, we do it for doctors, we do it in a 2-hour session, which is normally about the appropriate amount of time for it. But I'm going to be giving it a red hot try to get us through as many of these 25 topics, maybe even 26, in the time that we've got here today together. So jumping straight through into Zedmed here, I've got a deliberately small screen here so you can see it. In fact, I might zoom in to that one there. There you go, that's a bit zoomed in for you. So here's the normal opening screen of Zedmed that you'll see when you log in to Zedmed. And this, of course, is Zedmed Office. You can see by the red icon down the bottom and the standard tabs, reception, management, ports, utilities, that this is the half of Zedmed that's mostly being used by reception, practice managers and so on to do the billing and booking, things like that. To get into the clinical half of the software, you just go down to clinical records down here and click on that there. Okay, so we're in Zedmed Clinical now, and you can see down the bottom of the screen, we've got the two Zedmed icons there, the grey clinical icon there and the red office icon. So if you wanted to, you can move backwards and forwards between the two of those there. There's a couple of different ways that you can open a patient. There's Zedmed here in clinical. We could go up to open patient here. We could say, there we go, search on a patient there. And I've opened up Mr. Paul Hogan here. And this particular way of opening it, you only really want to use open patient for the patients. You're opening them for reference value. If they've come to see you, you'll be opening them and they're waiting for you in the waiting room. You'll be opening them in a different way, but you can open them, generally you'll open them this way for reference value if they're coming to see you later in the day, later in the week, something like that. You need to check something on their files. Now, apologies if everything's a little bit squashed into the screen, but I wanted it to be as simple as possible for you. The different sections of the screen, which we'll go through in more detail in a moment. We've got the history view on the right-hand side here, which everything in the encounters goes into the history view. By default, you're seeing the last 10 consultations in that section there. But also everything in that goes into the history view in chronological order also gets filed into all of the different categories in the summary views. You see in the newer versions of Zedmed, the summary views tabs are down the left-hand side there, but depending on how much screen space you've got, and we'll probably move it around in a bit, they might go across the top just to save you some space. So yeah, everything that gets put in chronological order on the right-hand side also gets filed into the different categories on the left-hand side there, like referrals and immunizations, allergies, medications, and so on. Above that, we've got the patient's demographics, address details, and so on. And right down the bottom, we've got important details generally in red, about their allergies, warnings, and recalls, things like that on the particular patient. As I said, opening the patient using Open Patient is a lot of the time is usually just for reference value. If the patient's actually come to see you and then they're in your waiting room, you'd be using this waiting room button here. So in this particular waiting room here, this is just showing the patients that are waiting for me. I'm currently logged on as the Dr. Philip Davis, and you could see there's a couple of particular patients in the waiting room there. We can see the names, we can see the appointment times when they were booked, for their appointment was booked, the attendance when they actually attended. You could see this Rachel Griffiths was a little bit early for her appointment. And then at admit time, you could see when the doctor admitted the patient. Remember, this particular waiting room screen here shows just the appointments for the doctor that's logged in. So reception will see all of them. And so if you've arrived the particular patient from this screen here, it'll mark in that admit time there. And so reception will be able to see that as well. So they'll see that the doctor's admitted them. At the end of this line here, you can see any attendance notes that may have been left by reception. You could also, if there is from time to time in the doctor's column there, you may see 3 question mark icon characters there indicating that this is a walk-in patient. So for sites that have walk-in patients, you'll be able to see that on this as well. And whichever doctor picks up that patient first, it'll go straight to them. Anyway, the best way to open a patient who's come to see you for an appointment is via the waiting room there. There's a number of useful different things that come out of that, including the ability to send the billing information straight back to the reception waiting room as well. It's the recommended streamlined process. So I could either, to admit this patient, I could either select that line there and click admit, or double click on that line. I'm going to select that one there and click admit. Yep, some little warnings there, the patient's pregnant. Okay. As you can see now, there's a bit of a difference that it's opened because we opened them up from the waiting room, we admitted them there. We've now got the current encounter has started on the right-hand side there. Above the history view, we can always drag these boxes around. We can make the history view a little bit bigger. There we go. You can see it started a timer. It's automatically ticked the box there. And like I was saying, if you recall, it will also send billing back to the waiting room at the end of that session as well. So we'll go through each of these categories again here in some more detail. I might just adjust this a little bit because as we've got so much squished into this screen here for my tiny screen, it's putting it in 2 columns there. I'd much rather, there we go. If we adjust it a little, it'll put it all across the top there just to save us some space. Okay, so we're going to go through each of these sections in detail here. Up in the top left here, we've got the patient's demographic and address details. We can adjust some of that by coming to the bottom right corner here, where there's the X. This takes us onto the 6 different tabs of the patient details. You can see this one, just general details of address and so on. Usually mostly reception fills that in, apart from in the bottom right corner here, there's this little clinical section here, which just the doctors can fill in. We've also got details like next of kin emergency contact, family, social and past history on this screen. At many sites, it's required for proper accreditation to put at least something in each of these fields. Even if you have, for a new patient that is, even if you have nothing to say for a particular one, at least put nil or NA in some of those fields there to indicate that you've asked questions about that for those particular new patients. We've also got detailed smoking details. We could say something like smoker, started in 2001, cigarettes a day, 5, something like that. Alcohol, now if you fill in all of those details there, including the ones under further questions there as well, It'll give you the World Health Organization rating of that patient's alcohol level. And then you've got the Other Clinicians tab here. This is where, if you're a specialist, you'd fill in that general practitioner line there. Any doctors, including GPs, might want to fill in this Other Clinicians section there. This whole screen is for doctors that need to be kept up to date about this patient's referrals and letters going out by default. You see, we can add somebody into any of these sections by using the specific address book set up by the practice management, set up by the specific practice. So I can click on the magnifying glass here. Let's see, I might just do a find to bring in the whole address book there. Pick a random doctor there, and you see this doctor is now going to be automatically CC'd in to all of the letters and things sent out for this particular patient. Okay, let me just adjust this here. Excellent. So let's okay on that one there. Save that there, and you notice in the top left corner here, we've now, because we've said that this patient is a smoker, we've got a smoking icon there, and if you hover over it, as you see, it's got the text indicating the details of that patient smoking. There's the pregnancy details there. There's also, if the patient had a healthcare card, that icon would be shown up at the top there as well. Okay, proceeding over to the right-hand side here. As you may have guessed, this is the section when you type in the notes about the patient. You can just free type in there. You can also set up a variety of shorthand codes inside the system there. You can set up your own individual ones, or other people at the clinic can set up common ones for everyone to use. I think at this particular place here, I've got, there you go, I've set it up so if I type IMM, it suggests the phrase immunization. Or you can have multiple ones as well, like like stages. So I could have a little sort of template that I can fill out there that I've set up myself. Now you can, we call that auto text, and that's set up at each clinic by any combination of the doctors and practice managers and so on. If you need to see that auto text there and where you set it up, come up to the tools menu up the top of the screen here, come down to clinical WP setup and auto text. There's auto text here. As you see, we've got a variety of different ones here, and these ones could be set up just for, these ones are set up just for use for this particular doctor, but they could be set up to be accessible by any of the doctors. You see, if we come down the bottom here to add new, we can type in the shorthand and whether or not it applies to all users, and then the long text there. So like I say, you could use it for large chunks of text. You want to put it in either in the encounter notes or any of the letters, or you could just use it for words that are tricky to spell. And they're in there as well. Now, generally, particularly for GPs, sometimes for specialists, you'll have these two concepts, the RFE and the problems. Particularly for GPs, for each encounter, you will have both an RFE and a problem for them. They're two things that go together there. So the RFE is generally the reason for encounter. It's the patient's presenting problems, their syndrome, whatever they've come in with that day, what they're saying. The problem will generally be your diagnosis, your considered rationale for the particular thing that they're having there, the particular name for the thing that you're going to be tracking over time there. But the RFE, as I said, that's generally just what the patient's reporting. So it could be something like a rash or a fever or a sore leg, something like that. So we might put a few of these in. Let's put the rash in there, and I can click on the blue plus sign to the left there to add in another. Let's make a fever, because the patients like leaving everything to the last moment and bringing 3 problems to us at the same time. What we can also do, at some sites might like to have, instead of you always needing to free type an RFE in, some sites might use coded RFEs as well here at the end of the line. Some sites do it, some sites don't. So at the end of the line here, let's Let's see, what do I have? Yep, so I already have a fever one there. So you can have a whole, some of these predefined ones will also add text into the encounter notes as well. Change this one from being fever to being sore leg. So we've got different problems there. If you wanted to set up any of these coded RFEs or see any new, to see what other ones are in there, we go up to the tools menu there. We come down to clinical setup and the RFE code section there. Obviously it's a test system, so I've only added a couple in, but as you see, you can have a large variety of them there if you want. I see that some of you are sending through some of the questions there. I'll just remind that we will be leaving the questions to the very end, seeing as we're going to be running through everything so quickly, but we'll cover your questions at the very end of the session there. So there's those 3 RFEs in there. So remember I was saying we pair each of the reason for encounters with a problem. At some specialist sites, you might not need to have multiple RFEs. You might not need to, you might not have specific problems that you want to attach to it. But generally at a GP's, general practice, you would have both of these. So what we're going to do for each of those 3 issues there, we're going to assign a problem to it. So we're going to go up to this particular first of these buttons in this long list here and click on that. You'll notice if we do hover over any of those phrases there, it does pop up the explanation text underneath it. It is possible to make that screen display the words underneath each of the buttons, but then it pushes all of the buttons across to the side, makes a very, very long list that you have to scroll around. So that's why personally I like to have it so that you just hover over it to see the text, but you can change it around in your own personal options. So let's go into the problems section there. And you can see up at the top of the screen here, we've still got those 3 tabs there with the rash, the sore leg, and the fever. And then we can come down to the second half here to indicate which particular, to give the diagnosis or the particular coded problem that we're going to be tracking over time instead of just a generic term like rash, for instance. You see in the selection method, we can pick existing problems, so an issue that we've previously seen this particular patient about, or recent problems, so lots of problems that you've been encountering recently as a doctor, perhaps COVID-19 or something like that. But a very popular one there is the predictive search, the ICPC. So many sites have the ICPC database loaded in. That's the third-party database, international database of problem codes. So we'll leave that open there. So rash, we might be looking for chickenpox. So we can start typing it in there. And obviously the more letters you type in, the more it will reduce that set of options there. So let's see, I'm going to pick chickenpox. I'm going to put an onset date in down here. And I'm going to select a problem there. You can also use this screen to add to history, so issues that the patient's had in the past that you're not necessarily connecting to a particular tab. Or you can also mark issues as common. You'll notice if we type in that one there, that there's some at the start of the list marked with a C. So issues indicated as common at this particular location, that they'll always appear on the top of the list there. So as you see, we can pick any number of these here as well. So recent problems, maybe diabetes. Anything in existing problems? Nope, nothing in the existing problems there. So we'll close out of that there, and you see we've defined the problems on the 2 of those there. Generally, we'll go through each of those tabs there, and you'll mark them as a problem. Like I say, GPs will always want both an RFE and a problem marked on each tab, whereas specialists are more likely to pick just one out of RFE or the problem tabs to be using. And as we go along through this, you'll see that it adds those notes into the history down there as well. You could see on the left-hand side here, remember I said everything that goes into the history also goes into these summary views on the left-hand side there. The next button here is the prescribing medicine section. Now, Zedmed will force you to, if you haven't already given information about the patient's allergies, Zedmed will force you to fill in that first. And in this MIM search here, for instance, we could look for a medication there to prescribe. And you could see on the list that we bring up here, we've got G marks generic medications. You can also see, well, if we expand some of those, you can see which particular brands are available under there. You can also see in this second column here which things are authority, which things are restricted, and so on in that list there. And when you prescribe, so let's prescribe one of these things. Prescribe button there. Obviously warnings. Yeah, warnings with some of the allergies we've got no doubt. See on this screen, there's a variety of different options and things. Most of this is about getting the medications dosage right there, which could either be free typed in there, or you could use the dosage calculator at the top there to fill in those details, or you could either add in the dosage from the MIMS dosage up the top there by drag clicking and right clicking there, and you can paste a dosage. It'll put it into the dosage there. If you've used the calculator here, this date in the middle will successfully interpret how long the medicine is going to last until. So that date will go blue there. Alternatively, if it hasn't understood your particular dosage there, you can always manually set it by clicking on that there. A variety of other things you can change around the screen there with repeats, whether it's short-term regular use or sometimes you've got PRN option there as well. Section 100, regulation 24, and so on. You could also, if you're going to be frequently prescribing this particular dosage for this particular medication, you can always click on the add favorite there as well. So that means you'll always have the option to prescribe this particular medication at that particular dosage. You'll be able to just go straight to it without having to go through all the stages of choosing the dosage and everything. So after that, people can either prescribe as the standard option here, but moving forward with new versions of Zedmed that's slowly rolling out around the country there, you'll also be able to use the electronic prescriptions on the side there. That does require that you have a pharmacy that is compatible with that as well. It's part of the main stopgap at the moment. So that's that section there. The next icon here is the observations. We can see with the observations, pretty self-explanatory. As you move through these tests and things here, we could say put a blood pressure of, whoops, not 210. Let me make it 120, that's what I was intending. Over 80 there, you see it automatically moves across. And if we did need to take another set of wait 5 minutes and take the blood pressure again, we could click up the top here, add another set of observations, and it would blank out that page and give us a chance to put a new set of observations in while still keeping the previous measurements as well. You see it's recorded the previous measurements into the current encounter notes, but it'll also put it into the summary views on the left-hand side there as well. You'll see if we do add another set of notes, you'll see it's kept that there. If we did need to get back some of the previous measurements for this particular patient, we can always double click in the particular column there and it'll bring back that particular medication, that particular measurement from the past. Variety of different things there, blood pressures, height, weight, BMI, waist measurements, so on. you can see the blue icons next to them there. It will give you a graph of that particular measurement over time. Not very exciting in that particular case. If these do turn out in the wrong particular tab, because they get put into whichever notes you've got open there at the time, you can always just copy and paste them into one of the other ones to move them across. Also got INR measurements, same sort of thing, and you can put the comments in there. Pathology, same sort of thing, mostly used for if your electronic results have not come through to you properly. You can put them in here. And there's a section for respiratory function as well, putting in details for a spirometer, and even if you've got a spirometer connected to the machine, you'll be able to pull it in through that as well there. That's the measurements one there. You see it's filling in the details there. Measurements also there'll be a measurements tab down here as well, which you can always, even when you're not in encounter, come into the measurements section. And this little eye symbol on the left-hand side of the screen here will allow you quick access to the various different graphs and tables for the measurements. So you can always access those at this side of the screen, even when you're not in an encounter. The next icon along here with the X-ray symbol on it there. Oops, just drag that down, it's getting a little slow. X-ray symbol there is the referral screen. So this is where we can do the pathology referrals, the radiology referrals, and the referral letters. So pretty straightforward sort of thing here. You can have, you'll see we're on the pathology tab at the moment. You can have a variety of different, in this test database, we've only got one, but you can have a variety of different pathology labs set up there, and always the particular clinic will have one preferred one set up there, though the doctors can override that with their preferred one. You can see it's automatically going to copy details of that referral to this particular doctor here. And you could leave notes that are going to be attached to this particular referral in the encounter notes over here if you like as well. You can free type in there. Underneath the green bottle there, you see we've got a variety of tests we can pick out from this list here. You can even, if you single click anywhere in here and just press a starting letter, it'll jump across to that. You don't need to always scroll. And as I'm sure you've already seen by these green ticks, you can mark some of these as being your favorites. So they pop up on this small list here. You can always add or remove things from that particular list. You've also got, in the test section, you've got groups of tests that you can build up. So, there could be a group of HIV tests or STI tests that you want to just prescribe in bulk. Let's see if this one's got many in it. Just double click on that there. No, obviously haven't added anything to, or maybe added a couple into that there. There we go. So if you wanted to edit any of those or see what's in them, you could just right click anywhere here. And you'll be able to see inside those tests there. So you can build up your own tests. This is specifically at the practice, just by moving anything from the all test side to the included tests there. And these tests are automatically available to all of the doctors at a particular practice. You can see it's got a whole heap of them selected on the right-hand side here, and we can right-click to remove individual ones from that list. And then we just prescribe them there. We can say, okay, yep, we want it to be on the chickenpox one perhaps, and order that test there. Radiology is effectively the same there. Then we've got the referral letters there. You can see it's automatically picked up the name of that particular doctor there as we're sending a letter to. Always a good idea if you're sending a referral letter out there to fill something in on this letter subject line here. That letter subject line, by the way, isn't actually sent out to the receiving doctors. That's just for your own personal files there. but it's a good idea to put something in that there. We might say diabetes review, just to make it properly stand out inside the encounter notes. The difference with this to the other kinds of referrals is that when we click write letter, whoops, let's pick diabetes to attach it to. Yep, so now it's popped up effectively the Microsoft Word template here. There's a bit of a fancy one here, and it's going to have details of you as a doctor. It's going to have details of the patient, and also who you're sending, the doctor that you're sending it to. And so these templates are set up and can be changed specifically by the practice managers at each site there. But as you as a doctor, you'll still be able to use your auto text codes, things like typing IMM or STAG, whichever sort of things you might have set up there already. Remember, those are the auto text codes we showed you earlier. But you can also do things like, if we go to the View menu and bring up the data toolbar there, we can open up various categories of information here from the patient file. So for instance, we could go into clinical details. Let's move this out of the way here. And go down to smoking there. So if I double click on smoking, you see it puts in that smoking information in from the patient's file. So when I've done all of that, I can just close it off, save the referral letter. Yeah, it's attached to that tab and ready to send off. You notice because I actually said diabetes review is the letter subject, that's how it will be listed in the patient file. And normally when you print them off, it'll give you the option to put them on the pre-printed paper and so on, apart from the referral letter, obviously. So moving along, we've got the immunization section. So we are going to cover all of these ones here. So don't worry, some of them will get a bit faster there. Immunization here, pretty self-explanatory. We'll show you what past immunizations have been given for this particular patient. Click add there. You'll see fairly straightforward. You can type in the immunization type there, or this is also a drop down that you can select at the end of that line there to pick it from there. Date given, dosage. Now remember, dosage will be like dosage number 1 or dosage number 3. It won't be the particular measurement. It won't be like 10 ml or something like that. You can also, if you have multiple batches at the particular site, you can store the particular batch number in there so that if you're using multiple immunizations from the same batch. Fairly straightforward there. But what would happen if this person, instead of being 51, was considerably younger? So we'll just change her birth date. So she's now 2 years old. So as you may have guessed, if they're within the right age range, so it's 2-year-old here, it's bringing up the childhood immunization schedule. So instead of it just being a blank section there, and you'll see it gives a guide as to what particular vaccinations should be given at which particular levels. But while you can double click on individual ones of these to bring up that particular vaccination with the dose pre-filled in, and you pick the particular brand there, one at a time. Instead, you see it's highlighted roughly about the stage that the child is at, roughly about the 18 months. So you can double click on the 18 months there, and then it will go through each of those particular immunizations. You could either give that immunization or skip that one at that particular occasion. So it's a faster way instead of having to go and pick through each one individually. And you do still have that bottom section down there where you can individually add non-scheduled immunizations, just the same as you did with the adults. So we'll return her back to her age, unfortunately. All right, that was immunizations. Next one here, we've got allergies. So allergies, like I said, if you don't have the allergies information, anything filled in the allergies section, Zedmed will force you to come into this section to fill it in first. You can, if you know that the patient has no known allergies, you could always just click this no known allergies in the bottom left corner there, and it will mark them as no known allergies, and it will close the screen there. If they previously had no known allergies, you will need to come in here and untick that box first before putting the allergies on them. You can see by the up in the top left corner, it shows the current allergies we know about. On the right here is where we're adding the new ones in. So medications you add in by brand, generic, or substance class. Let's see, substance class, we could probably type in something like, you don't need to type the full name in, and there's penicillins, for instance, we could pick from that list there. Alternatively, if we wanted to go for food or plants or animals or whatever, non-medicinal is what we'd pick from there. So if we select penicillins, clinical manifestation there, you'd want to pick either unspecified or search through the various options there. Severity, date of onset or not known, so we can do save that there, and it's on the list. If we close out of that, you'll see every time you add a new allergy to the particular patient, it'll be give you an extra tab up the top there, and it'll also be in the encounter notes, but it'll also pop up in the allergies on the left-hand side here under the summary views. Okay, and now for some small ones. Diagrams. You do have the ability to draw on various different diagrams of the patient. So on. Annotate it with words and things. And if you do erase anything on this, it won't erase any portion of the image underneath. If we OK on that one there, it'll just save it into the patient file. We can also upload photographs from your computer into the patient file as well. I'll show you that in just a moment. Now we've got, to change the tab there, we've got this templates option here as well, which allows us ways to quickly add in encounter notes just by clicking a variety of things on your screen. So if we open up the abdomen examination and click around this one here, just a few random things, and click OK, it'll expand that in full text without us having to type in all of that, just sort of like a quick checklist sort of thing. Next option along there, the pregnancy module. In the pregnancy module, you can see this patient is pregnant at the moment. See up in the top there, it's got gestational age by last menstrual period or by scan. All sorts of details you can put in. You can fill in an antenatal record in the middle. And if and when the pregnancy comes to the end there, you can give it a particular reason and fill out those other details there, finish date and so on. There's a number of, you can get a summary report out of this or even an antenatal report as well, which is the whole details in the middle there. Obviously, while the pregnancy is still going, you'll have that icon up in the top left there, the details there. The next option we've got along here, chronic disease management. So you'll see this is the care plan section of the package. So you'll see here that Zedmed uses a number of different rules to work out which particular care plans that the patient might be eligible for, or so on. You can see some of these ones here are marked ineligible. Up the top there, there's one in bold, so little bold ones that the patients are eligible for, and put the word eligible, obviously. Variety of different plans there. If you are filling in that, you'll be able to fill in the particular template. So you can, as we pick the different sections here, it has different bits down the bottom. But if we select this one up here, you'll notice that we can choose which particular care plan that we want to fill out. You'll be selecting that and clicking on Run to fill out that care plan. And that'll get added into the patient file as a document, and it could also be printed out. The calculators here, quick and easy ways to calculate things. There's a couple of mental health ones there, the DSS and the SLUMS, but also the renal function calculator you've got there as well. A few different there. I'm often asked about the K10. The K10 generally gets added as a into our template section, which I'm about to show you. Camera section, as you may have expected, that's how you use that middle option there to import an image into the patient file, a BMP or JPEG there. Next icon there just jumps us back into that same family and social history part of Zedmed. You can also do this as spell check, and you can also backdate encounters by up to 7 days. That next option there would be lit up with green or yellow if this particular patient is connected to My Health Record. I won't be covering most of the My Health Record stuff today because this is a test system, so we're obviously not connected through to that. But that's what that section would be there. So when you've, at the end of an encounter, what you'll normally do is you'll click the stop on the right-hand side over here. And you'll see that it's popped up the billing details section to pass billing back to the reception team. Now, if you hadn't arrived them from the waiting room, it wouldn't have popped up this section here. This particular, this one here, we can choose particular items from the left-hand side here as you go on. So obviously this particular test doctor hasn't been used all that much, but as you go along, this section will fill out with your most common items here. So we could say, oh, yep, I did a 23 today. Whoops, I don't need two 23s. And delete that there. So normally you just click there. You could also go to the Find Item section there to look for items that are perhaps less common that you haven't billed recently. You can add in there. And this is just supposed to be the quick way. You can just pick them from there. If you use this section up here, they'll be able to go straight into the invoicing section for reception. If you put them anywhere else, people will have to retype it and stuff like that. And it will be not so much, it'll be a little mucky. Yeah, we should, hopefully everyone still has sound. We'll just keep moving along here. So this middle section here, this is where you can predefine some canned phrases that you might want to use, like this section could say bulk bill, private bill, rebook 1 week, rebook 3 weeks, for instance. So that section, you could set up some just little canned phrases from you as a specific doctor. Just 2 moments. So yeah, so this particular section here, they're almost like little rubber stamps. So you could say, oh, okay, this particular bill here, I want this to be bulk billed and please rebook for 3 weeks. Just little common little phrases that you might want to send through to the reception team. While you can add some extra little text down the bottom, most of the time, it's the fastest thing to not have to free type anything there. So just double click there, double click on any items there. And we can save that and that'll send them through the billing advice through to reception. You can, of course, open up the encounter again by clicking on the green arrow, saying, yes, I want to continue the encounter. And you see it's opened up the encounter there again, and we could continue typing the notes perhaps if we wanted to. If we did, in fact, want to send through the billing information through to reception before we'd finished typing up the notes, which is a common thing. You don't really want reception to interrupt you to ask you what the billing should be. You could always use this billing wizard button down the bottom here. So if we click on that there, That's another way to pull up the billing details screen there. You can see we've still got this information there. We can double click on things to move it across. So that's a sneaky little way that you could send through the information through to reception without having to finish your encounter there. That's also what you'd want to use if the patient sneaks in somebody else to come and see you as well, say they're bringing their kid along or something like that, or their parent, people who don't actually have a booking in the system. Let's just close the encounter there. So some more details there. We've got to still do have a few more things to cover. So if we come over to the left-hand side of the screen here, you'll see just above the summary views, remember everything that was going into the encounter notes on the right-hand side there was going into the summary views as well. We've got these row of little icons along the top here. As I explained previously, this one shows the different readings and graphs for the measurements, the observations, things like blood pressure and so on, and various tables in there. This next little icon, small, very important one here, quick documents. So if we select that there, that shows a variety of the different templates that you can print out from inside Zedmed. So these will be automatically filled in with information about the patient's records, the doctor, and so on. Now, an important thing to note is that if you're producing them from here, these ones will be ones that you'll just be printing out. So forms and things you'd be printing out, not ones that you're going to be either electronically transmitting, not ones that you're going to be sending to a specific doctor. There's another way I'll show you just in a moment for that. Let's see what we've got here that I could pull up. Is there a medical certificate? I might just, certificate of capacity, that sounds good. And you see that this has already been pre-filled in with some of the details about this particular patient and their details. This whole list here is managed by your practice manager. So if there's templates that are not on this list, or perhaps there's too many on this list, or there's something wrong with the particular templates, have a chat to your practice manager there, and they should be able to fix up the particular templates on that list there. And generally, these are ones that are just you're going to print out and either give to the patient or potentially in some cases post off. If you do need to send it to a specific doctor, whether it is electronically or printing it out and sending it, you'd want to come up to New Letter up the top here. So New Letter, once again, gives the option to choose which doctor you're sending it to. Potentially, you would click on the magnifying glass there, which takes you into the address book. So you could select a particular doctor. So if you just used that previous section before, it wouldn't have had any doctor details attached to it. And once again, you could add subject, you can add CC doctors there, and then you can also access the full variety of templates there, even ones that you wouldn't do otherwise. Just as a reminder that this New Letter section isn't for the referrals. You should only ever do the referrals through the referrals section, because then results can be properly allocated to them. The rest of these little buttons down here, there's a to-do list you could set up for patients. You could run an ECG from there. And also this section here, once again, is used to connect to My Health Record. My Health Record, as I was mentioning before, not something I'll be covering today, but when you do, and we can send out manuals with regards to that, you'd be uploading them through this section here. Moving down on that particular page there, skipping over the summary views section, which we've covered in some detail there. We've got the reference views section below it here, which, as you'll see, got some of the allergies highlighted there. There's a section for warnings, where you can have warnings pop up in red there from the other doctors. Maybe this is person's aggressive sometimes, drug seeker or whatever, that can pop up in red there. You could also, if this little icon is lit up here, that means there's a warning sent through from the front of house reception. We've also got the recalls section along the bottom here. So recalls, as you see, we can add them in here. various different recall types, set the date that the patient should be coming back. And we could deactivate them when the patient comes in for that particular appointment. So if we close out of the patient's records here, let's just close both of those because we can. We'll also show you up the top of the screen here, we've got the results inbox. Now the results inbox is just your electronic results you may have received. By default, as a doctor, when you log into this, you'll only see the electronic results that are waiting for you. Should be able to drag up this section of the screen here. Oops. There we go. Oops. There we go. Just to get a bit more of that there. So yeah, this on your results inbox, it will contain results that have been sent to you electronically, but it also can contain results that reception may have scanned into you as well. Really, you won't care whether they came in from either of those. You'll be going through the list there. You'll be sending some of them to the nursing team or reception or other doctors. You could also, from time to time, if you open some of these, if your site has been set up with SMS, you could also use this screen to send out SMSs to those particular patients to get them to come back in and make another booking. And there's a variety of different statuses here. But while you can see all of the particular the new incoming results here, once you've marked some of them off as complete, you won't see them there anymore. You'll only see them on the patient file. Oops, I can't type. If we go back into that patient file again, just this one here, and go into the results section, you see that's where some of these results are as well down here. So you can always see the results. You'll see results for everyone in the of the results that are assigned to you in the results inbox there. But on a specific patient, you can check under the results section there, and no matter whether the status is I or P, so it's in the results inbox, you'll be able to see it there, or even if it's complete, you'll be able to see it's there as well. Also, and so that's the results inbox there. Outside of the encounter, we've got things like you have a library section here, which your practice manager may have filled with all sorts of forms and patient education leaflets. Your practice manager can fill that in there as well. There's a variety of reports under that section there, which might not be for use for you immediately, but have got a lot of useful stuff there over time. The tools section there, you can use that top option there, My Options, to change the look and feel of how Zedmed looks for just you as a doctor. Change some of the default options and everything there. Global options is used by the practice manager. Most doctors won't have access to that. You've also got, remember, clinical setup is where the RFE codes were. Clinical WP setup is where those shorthand auto text codes are. And you've also got intramail here as well. That's the little email, well, it's not really email, that's the little messaging system that's used to send messages around inside of Zedmed. So you can send a message to the other doctors or the other staff members there. Click on new there. You can even link them into a specific patient name as well. And so if they open that particular message from you, they'll be able to open that entire patient up there. If you do have new messages that come there, there'll be a pop-up on your screen saying that you've got a new message that will frequently appear there. Let's see which other ones. We've also got, like I say, as a reiteration, it's generally best to open the patients from waiting room, so the information will be flowing through reception as well. Things like scan will be used by reception, obviously, mostly not used. MIMS database, as we saw. Address book, remember you can add extra people into the address book there at your particular practice. travel advice, batch letter writer, used for some sites there. If you're giving dictation and the reception or a staff member is writing out those letters from your dictation, you could use this batch letter writer section where you they can type up your letters and you mark off as approved after you've reviewed them before they print them out. It's a neat little system there. As with all of these sections, we've got quite extensive information online. We've got web pages and manuals and things that we're happy to send out to you. We've also got this to-do list here. The to-do list is a to-do list just for you as a doctor that just to only you see this specifically. This is not normally per patient, so this will just pop up when you log inside Zedmed Clinical. The other doctors will see the patient's to-do list, but only you will see your own personalized to-do list here. So that there is a very quick rundown through all of those things there. Like I say, we're more than happy to send out any of the manuals that we've got. We've got a lot of information on the Zedmed website as well. I'll just quickly check to see what questions we have that we can answer quickly. I think there was some fairly in-depth questions here. Let's see. Yes, it looks like some more in-depth questions. We will endeavour to email responses to you there. Yeah, we'll email some responses there. I'll just quickly show you. Let me see if it's possible to bring up my website here. On the Zedmed website, remember, you can always come there. We've got our support number up the top. We've got the help button that takes you to our help website with lots of different guides and things on a number of these different topics. And we've also under support and training here. That's where you can find the new topics coming up for our Lunch and Learn, but also the videos we've stored previously. And let's see, where's that screen? Changing around. Okay. So thank you very much for that. As I said, please email any feedback to implementation@zedmed.com.au. And some details where you can either get more information from our client login portal, from our support desk there, available Monday to Thursday from 8 till 5:30 p.m. And Friday from 8 till 5, and emergency after hours support on the weekend. Thank you very much, and I look forward to chatting to you on another Lunch and Learn occasion.